Hello there. We are now moving forward to chapter 19, which is about childbirth, pregnancy, and childhood. So pregnancy, childbirth, and childhood. We are going to be combining chapters 18, 19, and 20 together for your future test. So you're going to need to read pages 488, section 1, and you're also going to read to section 2. You're also going to make sure you do the vocabulary words. Please make sure you keep all the vocab until all sections are done. And I'll publish those at a later day, but make sure all vocab are done at the due date. So the beginning of this life cycle, if you remember back when menstruation for the female, ovulation occurs from days 13 to 15. So that's the most potent time that a woman can get pregnant. So if the woman has sexual intercourse with a man, so penis, vagina penetration, sexual intercourse, the sperm travels up through the vagina, and if it attaches to the egg or ovum, then fertilization occurs. And then the egg will travel through from the ovaries through the fallopian tube down to the cervix. So you have fertilization. It's the first week of fertilization once the egg leaves the ovaries. Then the egg becomes a zygote, and that's within 36 hours. Then after that, it breaks down to more cells, which will be an embryo. So you have a zygote to an embryo, all right? So that's basically the baby. And then you have a blastocyst. So after 5 days of fertilization, all the cells are forming from one cell to multiple cells, and a blastocyst occurs. So it's no longer a solid mass of cells, it starts forming. And then implementation. So that's when the egg or the ovum puts itself along the urinary lining, which is the uterus, and that's when the baby starts developing. So if you move on to page 490, you're going to see a diagram here regarding the embryo. So it talks about the pictures of the wall of the uterus, the amniotic fluid, which is basically the water. All right, so the baby's inside the amniotic fluid. It protects the baby. You have the placenta. The placenta is basically the primary life source for the baby when it's in the mother's womb. You have the amniotic sac. So the amniotic sac is what holds the fluid and therefore holds the baby. Then you have the umbilical cord. And then umbilical cord also is a primary source for food for the baby, because once the placenta is off the urinary lining, the baby cannot live. So you have the umbilical cord, which is the primary life source, like for food and nutrients and oxygen. The placenta is attached to the mother's urinary lining. Then you also have the cervix and the vagina. The vagina is known as the birth canal. Okay, so on page 490, you have the development of the uterus. It talks about all of that: the amniotic sac, the placenta, the umbilical cord, the growing embryo. So it goes. Remember how we talked previously? It was a zygote to embryo to fetus. So you need to know the stages of that. So zygote, embryo, and then fetus. Yeah. Okay. So moving forward, you want to make sure you understand that when the baby's in the mother's utero, whatever the mother eats and drinks during her pregnancy, good, bad, or indifferent, it does affect the baby. So that's why you do not want to be doing any drugs or alcohol or smoking of any type. That affects the baby. Whatever the mother drinks or eats is for her as well as her unborn child. I have 3 kids, so I was very active during my pregnancy, and I ate a lot of food because I was, eating for me as well as my child. But there's times when you're tired all the time. You have a lot of energy sometimes, so you have to remember that you want to be healthy during this time frame. So again, amniotic sac and the placenta, umbilical cord, the growing embryo, and the fetus. And during the time, you have some pictures here on 491 that shows you the fetus at 3 months old. So you will see 3 months old in utero. You will see the fingers, the toes, the eyes, the head. And then at 8 months, definitely looks like a baby. So again, they starts out with one small cell. It breaks up into an embryo. So that's where the cell division occurs. Then implementation occurs during the urinary wall. Then after that, it becomes an embryo to a fetus. All right, moving on to section 2. Healthy pregnancy. So when a woman is pregnant, like I mentioned earlier, she needs to eat healthy. drink a lot of water, have calcium, take prenatal vitamins, needs to go to a family OBGYN, which is a doctor who specializes in women's reproductive system. So proper nutrition is very important. Exercise is very important. I ran marathons and coached all through my pregnancies, and that helped my pregnancy. So if you weren't active prior to being pregnant, walking would be really good. It helps release, stress. It helps release, swollenness. And sometimes you want to make sure that you avoid drugs. But like some doctors will be okay with aspirin. But anytime you have to take medication, if you're pregnant, you need to go through your family doctor. But again, you want to avoid drugs, alcohol, and smoking. So a lot of times when women are pregnant, they can't take certain like no x-rays, certain procedures. They can't be around lead or mercury. They can't be around cat litter, which was really weird to me to find out. But I guess something's in the litter that affects the pregnancy and possibly some abnormalities. So I myself don't have a cat, so I never had to worry about that. Prenatal care is very important. So you definitely need to see a family OBGYN on that. There's 3 trimesters to the woman's pregnancy. First 3 months, second 3 months, and the last 3 months. The first month of pregnancy, the first trimester, is very important. It's vital. Unfortunately, research shows 90% of miscarriages happen the first trimester, so the first 12 weeks. I personally lost my first baby at 12 weeks. It was in May, and it was very, very, very trying, very, very sad. But, we got through it, my husband and I, and we now have 3 wonderful, healthy children. So the first trimester is very important. A lot of times people won't tell someone that they're pregnant till after the 12th week because they kind of like went through the scary stage, all right? Plus, it's literally like an alien growing in your body. I mean, you feel everything. You feel kicks, you hiccups, all that. It's very, very uncomfortable at times as well, all right? So the first trimester is the first 3 months. Second trimester is the middle part, and the last trimester is the last part. So you want to make sure that when you're going to the doctor, they do an ultrasound, they check and see the baby's, if all the fingers and toes are there, if the heart rate is doing well, the amniotic fluid is there's enough of that, the umbilical cord is long enough and healthy enough. So remember back when I mentioned to you about technology? Before they had no idea if their umbilical cord was short or wrapped around the neck, or the amniotic fluid was low. So technology has helped in many ways. Complications can occur all the time. I just mentioned like I had a miscarriage when I first got married, and I don't know why it happened. So we'd like to just think things happen for a reason. But there's a lot of complications that could occur. So you have ectopic pregnancy, miscarriages that I mentioned, preeclampsia, and gestation diabetes. So ectopic pregnancy is when the egg goes through the fallopian tube and it stops in the fallopian tube. It doesn't go all the way down to the uterus, doesn't attach to the urinary wall. So it stops in the fallopian tube. And fertilization is occurring, but it doesn't go to full capacity because the egg is not able to grow. So some women who have ectopic pregnancies, they don't go to full term. It's really sad. But also having ectopic pregnancy can cause you to be infertile, and complications where surgery will have to be done. Sometimes women who have STDs will have ectopic pregnancy because of the scar tissue, because the egg is not able to flow through the fallopian tube efficiently. The fallopian tube is very, very thin. Think like a very thin linguine noodle, okay? And you have this egg that has to go through it. Miscarriages, like I mentioned, can happen for no reason at all. It could happen due to maybe like an accident, like a car accident or what have you. It could be because of any abnormality that could occur. My one friend, she had multiple miscarriages because her body wasn't producing enough calcium in her body. So when it came to like the 18th, 19th week, she miscarried her child. She did that 2 times, unfortunately. My sister miscarried 3 times because her body was not producing enough progesterone. So again, us women have progesterone, estrogen, testosterone. So when my sister was pregnant, her body again wasn't producing enough progesterone and she miscarried. So she had to go through some specialists so that way she could have her daughter. And she has a daughter today. All right, preeclampsia. So it's toxemia. So that's basically when you have issues with your protein, too much protein in your body, the levels are off, there's protein in your urine, and it's scary because it happens sometimes during the second and third trimester. Sometimes women, they don't get enough oxygen to the fetus, and there could be some complications. Sometimes medicine and bed rest will help, and sometimes the placenta tears away from the urinary wall. So if this was the urinary wall and this was the placenta, it will tear away. And that would be definitely a cause of possible death of the baby and or the mother. So when I was pregnant with my second daughter, I had some stress going on, and of course I suppressed it like a lot of people do. And I was on the onset of preeclampsia. Fortunately, my heart rate was okay, but my blood pressure and my sugar levels weren't well, and they were just worried about my stress. So my one daughter was early, and the fact that she was early, they said within 24 hours I probably would have lost my child. So it's scary stuff sometimes. So when it comes to gestation diabetes, this doesn't happen all the time to women who are pregnant, but you can get diabetes when you're pregnant. You get swollen, you have sugar issues, because it goes from the sugar going right to through the placenta. So a lot of women will have to be on bed rest, or perhaps they're concerned that their baby will be obese. So you have to just make sure that you're taking care of yourself when you're pregnant. When it comes to ultrasounds or amniocentesis, those are just ways for precautionary measures to take to make sure the baby's okay. So you want to make sure that you cover these vocab from chapter 19, section 2, and make sure you do not turn your vocab in until all sections are done. So again, make sure you read sections 1 and look at the diagrams regarding the fertilization. Then you have section 1 as well, showing the picture of the development of the uterus, and take a look at the pictures on page 491 regarding the fetus at 3 months old, and you will kind of see the amniotic sac and the fluid there. It kind of looks like a balloon with water in it. All right, and the mother can feel the baby kicking, hiccuping sometimes. The mother can literally see the baby in her womb move back and forth. I personally did all the time. I remember driving to one of my practices when I used to coach cross country, and I was driving down Hall Road, true story, and I was driving and I was like, oh my gosh, and I look and I literally see a little foot pushing out. It was stuck in my rib and I had to push it back in, and then of course I'm driving along again at that same time, but maybe 5 minutes later, and then another jab into my rib, and it was the other foot. So I take it, my first daughter, at the time, I didn't know she was a girl, but she was stretching. So you definitely feel pain sometimes. And you go to the bathroom a lot as a woman, because the bigger the baby gets, it presses on your bladder. Again, section 2 is about healthy pregnancy. There's a diagram regarding nutrients and what you should eat. Some foods, again, wouldn't be a factor. Some will give you heartburn. I craved ice cream every day for my first pregnancy. I craved all kinds of fruit for my second pregnancy, to the point where I was at North teaching and I had some grapes, and I'm in the hallway and I'm passing grapes out to some kids, and then I would eat them, and then I didn't feel good there in the afternoon. I thought I had pre-labor, and come to find out it's just because I had too much grapes. So these things could occur. Prenatal care is important. Remember, you go over that. And then we'll be moving on to section 3 and 4. All right, take care.